Welcome to the Suicide Prevention Series brought to you by the Public Hospitals Authority. In observance of Suicide Prevention Month, we are looking at the many factors impacting mental health and the root causes of suicide. I'm Arabina Apia. Thanks so much for joining me. Now, contrary to popular belief, suicide is a preventable tragedy, and while many persons are impacted both directly and indirectly, it's not always easy to know how best to help those around us, especially if those persons are senior citizens. Today, we'll be discussing some of the root causes of suicide and the ways that you can help prevent these tragedies from happening in your life or in someone else's. Dr. Daniel Lloyd, who is a psychiatrist at the Sandlands Rehabilitation Center. Welcome to the show.
Thank you very much for having me.
Okay, so let's talk about mental health in geriatrics or senior citizens. Why is it so important, or why is addressing mental health such a difficult thing for senior citizens?
In the senior citizen community, I think the major problem is that many people don't identify the fact that a person has a mental illness. And that's a really unfortunate thing because a lot of people can be treated adequately. Statistics show that approximately 1/5 or 20% of individuals living over the age of 65 years old suffer from some form of a mental disorder.
What are some of the mental disorders that a person in that age bracket might suffer from?
So most commonly it would be things like depression. Sometimes they can suffer from anxiety, especially how we recently went through the pandemic. They had a lot of cases with patients coming in unable to sleep, having nervous episodes whenever they go out in public, and so forth.
Okay. And how do we recognize specifically suicidal behavior in senior citizens? So we're talking about your grandparents or your great grandparents. How do you, as the individual, say, this person in my life might be suicidal?
So with suicide, it is closely linked with depression. So it's very important that we identify some signs of depression.
Okay.
And in an elderly person, you will look for things like decreased mood, if they have changes in their appetite, if they have changes in their sleeping patterns, probably sleeping too much or sleeping too little. They may express feelings of being alone or loneliness when they can't reach out to the family members, and that also happened along with the pandemic. People weren't able to go and visit their grandparents or their parents as much as they would like. And also, of course, the suicidal ideation and behavior. And when you're talking about those behaviors, you may see the elderly person, they may start giving away their prized possessions. They may start giving it to loved ones and saying things like, I will hope to not be a bother to any one of y'all anymore.
Wow. Okay. And what advice would you give to, a caregiver, maybe an adult child who's taking care of their elderly parents? What advice do you have for them in terms of not only identifying suicidal ideation, but accessing the resources to get help for their loved one?
So definitely familiarize yourself with some of the signs and symptoms. You can Google that information. You can talk with your primary healthcare provider. And once you're able to identify it, don't just let it go. Like actually take some form of action to get the person help. In terms of accessibility, that's one of the barriers that we look at in the elderly population. Because as you get older, you're having visual impairment, hearing impairment, and all kind of issues that limit your access to driving a car and going to your clinic appointments. So you also want to make sure that you're able to give time to that person and take them to their necessary clinic appointments, whether it's for mental or physical health. You also want to make sure they have good nutritional value food. Also make sure that they have some form of activity, getting some exercise in, and just make sure that they have a good support group. It's so important that they have a social network where individuals call and check up on them and take them out to family gatherings and so forth.
Let's talk about the statistics surrounding suicide among elderly persons. Is that something that we see quite often in the Bahamas?
So it is definitely something that happens. The frequency, I don't have the exact data locally, but worldwide or globally, It's estimated like somewhere between 16 to 20 per 100,000 of a population
Wow.
would have these suicidal behaviors and thoughts.
And in terms of local access, you mentioned, being able to make sure that your elderly, the elderly persons in your life have access to mental health care facilities, etc. In your role with the PHA, how does one go about accessing someone like you?
So I would say with the primary physician, if you have concerns, if you're the caregiver of an elderly person and you have concerns, you can bring up these concerns with the primary care physician, and they can do further evaluation. They can start you on medication. They can refer you for talk therapy. You can also be referred to a specialist, a psychiatrist, to get a further assistance.
Awesome. Well, thank you so much, Doc, for being here. This was very, very insightful conversation.
Thank you for having me.
We have more from the Suicide Prevention Series in a moment. Are you or someone you know struggling with suicidal thoughts or ideations? You don't have to go it alone. You can reach out for help. Call the Crisis Center at 328-0922, People Helping People at 698-0155, the mental health professionals at the Sandlands Rehabilitation Center at 364-9600, or the Community Counseling and Assessment Center at 323-3293.